Hi, I'm Scott Green. I'm a plastic surgeon at the Plastic Surgery Center, and this is Stacy Lassiter. She's our physician's assistant. She's important in all aspects of your care before and after your surgical procedure, and today we're talking about blepharoplasty. So a blepharoplasty is an eyelid surgery to remove extra eyelid skin from one's eye, and that can be either what we call an upper blepharoplasty or a lower blepharoplasty or a combination of the two. And there is some information regarding this also on my video about facial rejuvenation or facelifts. But let me tell you about the things I think are important. Normally what brings people in to see us for a lower blepharoplasty is that there is some extra skin around their eye, maybe lines around their lower eye that are bugging them, and or fatty tissue herniation in their lower eyelid. In our lower eyelids, we have, in fact, all around our eye, we have a septum or a kind of a sheet of fascia around our whole eyeball. If this is our eyeball, this sheet goes all the way around it and it hooks to our skull all the way around that eyeball. And that sheet of fascia or septum has fatty tissue behind it, and that fatty tissue cushions our eye. And in some people's situation, that fatty tissue, or excuse me, that septum or that fascial barrier has little rents in it or little weak spots in it that the fatty tissue can herniate through, or some of us are even born with fatty tissue that didn't all get put behind the septum but ended up out in front of the septum, which can create little bulges in our lower eyelids. And so you'll see that sometimes in people who are even very young. They'll have eyelids that have those little bulges in them, or they may develop them as that septum weakens over time and get little bulges in their eyelids. And typically we associate those bulges in our eyelids with looking tired and not being rested, and sometimes even looking older. And so people will come in to see us for a lower eyelid surgery, both to tighten the extra skin that we might have in our lower eyelids, because our eyelid skin is very thin, doesn't have a lot of elastin in it, and therefore ages a little faster than our other skin does, and also because of these little bulges. And we can treat those problems in a couple of different ways. The main way this problem is treated is with an incision right below our lash line that extends just a little past our eye. And that incision usually is pretty well hidden under our lash line, except this little lateral extension of it. And that allows us to lift up that skin, find those little fatty tissues that have either popped through that septum or were already there from genetic things. And we can remove that fatty tissue or move that fatty tissue. So either can be done. When we remove it, we simply take out the fatty tissue that's there, that's excess or that's popped through, take it away. When we move it, that means we take that fatty tissue that's there and we push it down into a different area that may not have enough fatty tissue. So often when we see bulges in the lower eyelid, we have a little trough or a hollow spot right below that. So sometimes we use that fatty tissue in those hollow spots to make that transition from our cheek to our lower lid much smoother. Then what we do is we take the extra skin and we pull it up sideways, trim the excess off, and then suture things back together with these little stitches called 6-0 prolines. Those get removed typically on day 5. Now, there's a different way to do a lower eyelid surgery. It's important to mention. As I talked about, some patients have these bulges in their eyes even when they're very young, and they typically do not have extra skin associated with that. And so in that circumstance, when somebody doesn't have extra skin associated with these bulges, we do what's called a transconjunctival approach. A transconjunctival approach means we make an incision on the inside of someone's eyelid, in here, underneath their eyeball and the inside of their eyelid. It's a very small incision, only about this big. And that incision allows us to look down behind the muscle in front of the septum and find those little bulges of fatty tissue there and remove them or move them in that circumstance as well. And that we can do without an incision on the outside that anybody could ever see. The benefit of that is, 1, there's no incision on the outside of the eyelid, and 2, we protect the eyelid and muscle from a scar in there, so allowing our muscle to have full normal function that never really has been altered in any way, and that can keep the tone of our lower lid tighter and better for a long period of time, allowing our eye to age more normally and not having any problem from the scar being there. Any surgery can have some complications, but an eyelid surgery with an incision on the outside of the eyelid, like we talked about at first under the lash line, does put a little bit of scar underneath the skin there, and that scar can make that lid not move or not be supported perfectly normally, and that would be a complication, of course, but it can occur, and a transconjunctival approach avoids that. The upper eyelid is another structure that has extra skin, again, because it's very thin, and may also have fatty tissue that bulges. In the upper eyelid, that bulge is usually more towards the inner portion of our eye. And what we do is we use the upper eyelid crease that is already there. That helps that incision hide very well. We use that crease and then remove that extra skin that's there and remove the extra fatty tissue that's there from our upper eyelid. All in all, an upper eyelid surgery is very easy to recover from. There's not anything special to tell you about the recovery or other issues regarding that, because it's a pretty simple surgery. It's not like you have to be up walking like you do after a tummy tuck. You can just go home and rest. You will find that it's hard to do things like read books or watch TV for the first couple days, just because your eyes will feel a little bit tired. We use little stitches that get removed typically day 4 to 5, and after that you just need to be careful doing things like applying makeup or rubbing your eyes, because the incision will remain weak for a few weeks after surgery. So it will remain not strong enough to hold itself together if we do something that really agitates it. So you just need to be careful with that afterwards. Additionally, with eyelid surgery, obviously our eyelids are important in covering our eyeball. And one thing that's important about the coverage that the eyelid applies to the eyeball is that the eyelid also moistens, or the whole structure area there moistens and puts oil or lubricant on the eyeball to keep it from drying out. You'll know this if you try and keep your eyes open for very long, it starts to feel dry very quickly. This is true after we do an eyelid surgery. When we do eyelid surgery on you, your eye will be slightly more open than normal, initially, and your muscle won't work quite as well initially. In addition, there are little glands in your lower lid that produce that oil for your eye to keep it moist, and those will not be functioning normally. Those three things combined together are going to try to make your eye dry and irritate your eye. So you as a patient have to do a lot to try and lubricate that. Make sure you put lubricant in during the night that we give you, and get an additional lubricant that you get from the pharmacy. That is just a drop that you can use during the day. When we do upper and lower eyelids together, we usually prescribe, Stacy will prescribe another medicine for you that is an antibiotic medication as well as a steroid medication, and it decreases the inflammation in your eye, taking away some of the swelling and things that can occur early on. But if you're really good at lubricating, you shouldn't have any problem with swelling or issues with that. The steroid then will just be there to prevent it if something like that were to occur. Some of the complications that are associated with eyelids would be something like dry eyes or chemosis, an irritation of the eyes afterwards. Another one is lag ophthalmos. If too much skin is removed, we can create a situation where long-term your eyelid might be a little extra tight that can create a dry eye problem for you. Lag ophthalmos, or your eye not being able to close, eyelid not being able to close completely, is normal in the first few days after surgery. When our eyelid muscle isn't functioning well and it's swollen, it doesn't close completely tightly, especially when you do things like shower or sleep. You'll notice when you shower, water gets in your eye at first, that first little bit. And that is something that will pass and go away with time, and that is why the lubricant is so important. Another issue that can occur is if we get any bleeding in our lower eyelid, or that eyelid starts to develop a little excess scar, the lower lid can pull down a little bit. And that's something that we might have you massage your lower eyelid for to treat that. typically within a few months it will go away. These are kind of rare, uncommon things that can occur, things like chemosis or things like what we call scleral show, where the eyelid pulls down a little bit, and they do resolve, they take time. And so if you have some problem like that, I will talk with you about that and explain to you how we're going to fix it and correct it and make it go away so that your eyelid surgery will have the ultimate result for you. Anything else you can think of, Stacy?
I think we covered it.
Alrighty, there is your eyelid consultation. There may be some other information on the facelift consultation that addresses some of your questions, but typically within a couple weeks you're kind of back to normal, exercising within 3 weeks, and really should be able to work and do normal stuff within just a few days.